I think to deliver it in a cost-effective way is about looking at collaborations across organisations, statutory, third sector, voluntary sector, to ensure that there's a mix of skills in terms of those who've got expertise in mental health, but also particularly third sector providers who can provide us with more creative ways of supporting and helping young people manage their lives. I think at the moment we're still raising awareness of the need to have more youth-focused mental health services. So that's moving away from the traditional children's services and adult services and having a youth-focused service. So raising awareness, developing collaborations, that's probably where we're at the moment. Well, what was involved initially obviously was to have focus groups of young people, understanding what are their assets, what are their strengths, but also what do they do when they're having to manage stress in life. And our view is the earlier a young person can manage that stress, either on their own or with the support of others, the better the outcome and the less likelihood that that stress starts to overwhelm them or starts to develop into more formal difficulties. The outcomes was that young people wanted non-stigmatised environments. They wanted environments that weren't specifically mental health, but actually looked more broadly at a spectrum of well-being rather than just mental health. The vision for the future is dedicated youth mental health services, which are a collaboration between statutory, voluntary, third sector and most importantly young people being part of that service delivery in Kent.